And we're excited to have another one of your friends with us too.
Yeah, I am. And you know, many of y'all may not know that I practiced surgery in Little Rock for many, many years. And I happened to be at Tenwick Mission Hospital, and I was standing at the OR board trying to figure out what cases I was going to do next. And I heard somebody say in a very country accent, "Paul, is that you?" And I turned around and I looked, and someone who had done anesthesia with me for many, many years there in Little Rock, Arkansas, was standing behind me in Western Kenya. And little did I know it was Steve James. Yeah. And from that conversation, I got to know about what Steve's doing and with Kenya Relief in Western Kenya there. And I can just say it's nothing more than amazing to listen to what God's done through this organization and through this man. So welcome, Steve. We're glad you're here. Tell us a little bit about how it all started, way back at the very beginning.
Well, let me tell you first, I remember the first case you did in the surgery. He's come a long ways.
I remember your first. No.
Yeah, well, you know, I practiced medicine, anesthesia all my life, and enjoyed my life, and feel like God's given me lots of opportunities. But it wasn't until my middle child, Brittany, started supporting a boy in Kenya that I even had an interest in doing something overseas. And unfortunately, my daughter never got to meet the little boy that she supported in Kenya. She passed in 3 days after 9/11, and so Daddy tried to figure out, you know, why would something like that happen to a beautiful child in the prime of life? And, you know, God sent me to Kenya to meet Newton. And so I went in 2002 and worked in a hospital, met the boy, but, you know, my life was turned upside down again. And it was then that I asked myself some really big questions, you know, like why did God give me so much in life when so many people didn't have? And you know, the message became very clear to me, and that was so that I could give back, so that I could do something to really leave an impact in the world.
How did it start then with Kenya Relief? So from that moment, from that genesis, from that thought, what then happened?
Well, I started working with their local hospitals around there, passing out pills and doing some of the things you do when you just start medical missions, and all the time knowing that, you know, a lot more advanced care, a lot more surgical care and other things were needed to really change, to address the problem. So I took back 7 friends, then 8, then 20, and fast forward, you know, 2020, we've brought about 4,000 professionals to Migori, Kenya, to work and serve in a variety of capacities.
4,000
right.
physicians, health caregivers.
Yeah.
And how many surgeries have you done?
Oh, wow. I mean, more than 10,000.
Yeah, it's amazing.
Yeah.
And not only are you taking teams over there and doing surgery, you also have, you're now building an actual clinic and hospital there. Is that not right? Tell us about that.
Yeah, right now we're set up more like a kind of an advanced outpatient surgery setup. So we're doing some pretty sophisticated surgeries in our facility. And of course our goal is to, you know, follow the lead of so many good hospitals that offer comprehensive care in, you know, in a faith-based environment. Yeah. And even going beyond that, you know, partnering to bring together the different government organizations, private hospitals, and kind of figure out how we work together to achieve our goals to provide care to everybody in Kenya.
Yeah, I think that's a real critical thing people don't think about, Steve, is that you have to work with the local government. And you have to work with the local infrastructure there, health providers and things like that. So I commend you on that. Now, so did you say 4,000 people you take?
Right.
Tell me how it changes someone's life. Now, you do anesthesia, and you take surgeons, and you do thyroids, you do hernias, you do things like that. If you have someone who's never seen suffering before or seen what it's like, how does it change them when they go with Kenya Relief? And what are tell me a story.
Well, one of the girls just asked me a moment ago, what did I like the most about mission work? And I told her, I love seeing someone that's blind see again. Yep. I love seeing an orphan taken from, you know, an environment where they had no hope whatsoever, and now they're given opportunities in life. I love seeing the lame walk again. But one of my favorite things is to see somebody like me who has everything in life and they're missing something. You know, so I love seeing the teams come and seeing their lives change, seeing them come home find purpose, more purpose in their life, and start giving back, you know, around the world, even at home. But it permeates their life now that they live differently.
It changes their lens, doesn't it? Changes their paradigm. So, you know, Steve, comment on this. Right now, in the United States, the risk of burnout, compassion fatigue, and depression amongst healthcare providers is at least 50%. What I've found, and I'm going to ask you, is if you take someone that's burned out, has compassion fatigue over with you, and they experience a week or 10 days of what happens over there, are they changed from that standpoint?
Oh, absolutely. It's life-changing, and it's pretty universal. I mean, how can you go into an environment like that and see other healthcare providers struggling because they don't have resources or, you know, and so on. But when they come home, you know, they have a new sense of appreciation for what they have. They work with their coworkers differently. You know, they use their own resources in a more, I don't know, humanitarian way. They share, you know, so yeah, that's a big impact.
Yeah, it changes their heart too, because all of a sudden they realize, you know, I may be fatigued, but you know, something happened on the missions trip. My compassion is now at a new level. You know what? That fatigue that I feel on the inside is different because I've seen really, what I tell people, it's like the reason I went into medicine is the reason that when I go over there and get to practice medicine and take care of patients, that's the reason I went into medicine. Sometimes it's just getting back to the reasons that we went into medicine that just kind of re-energizes us.
There's an oncologist that said the very exact same thing. He'd been in practice 25 years, successful, and he said, now I remember why I went into medicine. He got disconnected somehow or another in our system with what he's really created for.
Steve, I commend you on what you're doing. It's amazing to watch the humble beginnings of Kenya Relief to what you guys are doing right now. And they have been an integral part of M3 since the very beginning. I'm telling you, nobody has stood beside us more than Steve James and Kenya Relief. Nobody has marketed and promoted M3 like Kenya Relief has. And so we appreciate you and wish you only God's best in the future. And listen, by the way, thank you that you're letting Elizabeth Studley speak for us this year.
Oh my, I can't wait. I can't wait.
I'm going to give you a little teaser on that. She's going to talk about how she was broken, how she was restored, and now how she's bringing hope and healing to the world. And she's a dear friend of Steve James, and you have some plans for Elizabeth Studley in the future, don't you?
Oh my, this is the Global Health Conference. We're all about global health.
That's right.
And oh my goodness. Thank you to you and Jennifer and your fantastic team who's made all this possible. And we're counted a privilege and an honor to be just a tiny part of it all.
I appreciate it. Let's do this for another 10 or 15 or 20 years.
Hey, let's go.
Hey, thanks, Steve. I appreciate it.
Steve, thanks for coming by.